Me, 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 me. Do, re, mi, fa, sol, la, ti, do. Chilling in the icebox. We got a lot to say. Chilling in the icebox. We got Mo today.
Oh,
What's up,
see
guys?
how I do.
Welcome back to Chilling in the Icebox. So, how's it going?
Oh man, we have a lot to talk about today. We have special guest Mo. She's been on the podcast before from when you guys did your competition, the Mojave Games.
Before the competition,
Yeah,
Before,
we
yeah.
we did
we were
the
gonna do an
podcast.
after.
We still have to do that after. That's good. We could do that today too.
Well,
We're going to talk about the medical machine.
Laura has a lot to say.
Oh yeah, there's some heat there. Maybe that's our hot take.
oh yeah, okay. Okay.
But let's kick it off with 10 secs. Laura, you go.
Okay. I had a whole day with my sister. My sister's in town, and we had a whole day unbothered without kids.
What?
That is 10 seconds right there. Just shut off the show now. I'm just kidding.
Wow.
It was so fun. It was
A
so fun.
Christmas
But
miracle.
it was a true Christmas miracle. And dude, we just went to so many stores. I have so many 10 seconds. I don't even know.
Oh, she's a Utah
Is that the
girl,
Stanley?
officially.
Stanley. But my sister says it's a Texas thing too.
Oh, okay.
But it is the Stanley. I had to get it. I was like, I'm tired. I'm tired of like in my head thinking that it's not worth it. I really need to test this and like
Mhm.
do my own personal review. So far I've used it for like 2 hours, maybe. um the only thing is like it's a good thing to have uh like daily, but I don't feel like this is a good thing to like walk into a gym with,
Okay. Yeah.
which is kind of like annoying because we
You're
spend most of
always
our time in
walking.
the gym.
Yeah.
Yeah.
hmm
But it is cool. Like if this fits into my cup holder
I was gonna
and
say, how about like driving or just like
yeah,
living your life?
and
Yeah.
it's really easy, like little sip here and there, and like it's
Mhm.
that. But I'll let you know in like maybe the next 10 secs that we do next week. But that was this. So Dion got one too, and
Nice.
we're testing it out. She says it's a Texas thing too, and I was like, no, this is totally Utah. This is a Utah. This
I
it's
I
almost
do I do think that the Stanley like straw setup is a little bit more civilized than like the Hydro Flask straw. It's just like a little bit more like dainty and like ladylike. No tea,
yeah.
no shade to Mo, who just took a big sip out of her Hydro Flask straw. But see, I'm featuring the Soda Stream with a straw from IKEA.
Okay. I'll let you
A
guys know
sticker.
though. 10
Everybody,
secs. Well,
that's
and
the
then I was
thumbnail.
like, is this not like appropriate? Do you not put stickers on the Stanley? Like, I don't know. I don't
Oh,
know Stanley etiquette here. So, comment below, people.
yeah. Okay.
Comment below. But I did have a whole fun day, just like a whole day without being a mom. And like, we went to Olive Garden and we sat in the bar area because the wait was like an hour. I wasn't drinking or anything, but the wait was an hour long. And I was all, they're like, well, the bar's open seating. And I was all, we could sit in the bar.
Coming through. Yeah.
And then we went and sat in the bar. That was fun.
Did you have unlimited soup, salad, and breadsticks?
I ate myself into like, I ate so much that I was like, we have to go walking because we'll fall asleep right here. We have no kids right now. Like, we're gonna fall asleep. Like,
Oh my God.
um,
How
I will
fun.
say though, it's different being a mom because like you start shopping for your kid, even though you're not with your kid. And I'm
hmm
like, and my sister has two kids. So I'm like, is this like a normal thing? Like, why am I shopping for my kid? My kid's not even here. I'm supposed to be having a day for myself. Like, and I was shopping for like, just like, look, I could like find myself like looking for things for like Dennis or like Aria. Like, I'm like, this is supposed to be about me. Like, bye. But that's it. That's all. That's all. Oh, and
That
I went to
does sound
Chick-fil-A.
fun
I
though.
went to Chick-fil-A. That was
Oh,
my whole
wow.
day.
Wow. Olive Garden and
Olive Garden,
Chick-fil-A.
Chick-fil-A. I know. I
You
wasn't
were
even
in
really
St. George,
hungry.
baby.
But Dion was like, we gotta eat dinner. Like it's getting late. And I was like, all right, fine. Let's go Chick-fil-A.
It
So we
does
did.
sound like such a fun day and like how cool to get to hang out with your sister like that, like at this
Yeah.
different stage in your life, you know?
Yeah, it is. it was fun because I never ever ever just like get every time with my sister. It's like kids are
Mhm.
there for
Yeah.
kids, which is fine. I mean, I'm not complaining, but it was so cool to just have a day.
How fun.
Now I feel
I love
refreshed.
it.
Yeah.
Okay, how about
Okay.
Mo? What's your 10 secs?
My 10 seconds is Maddie and I went in guns blazing with our workout today, talking how we were going to get these great deadlift numbers. And I couldn't even pick up 205 from the ground. So
You did like 8,000 deadlifts like 3 days ago.
Yeah. That matters. That
It-
does matter.
I tried to tell her.
Also, you know what else matters? If sometimes when I like eat a lot and I don't feel like myself, you know what I mean? Like you just
yeah,
like
the
if I've been just like off,
holidays.
yeah, like you've just been like off, a little off. And
Yeah.
sometimes it'll happen. It's fine. It's fine. But
Plus,
And
I
it's
mean,
been
you
since
got
Thanksgiving.
to be fair, you had it up. You
that's
had
what
it
I'm
up.
saying. She pulled a
You had
heavy
it up.
bar.
No, it was up. I was like, well, what? Like I watched the video like more than once. My sister was like, how many times are you gonna watch this? And I was, dude, she has it up. Like
No,
just stand.
I did
Just
not.
stand. It was in that moment.
it'll be up next time for sure.
Yeah.
I
Yeah.
have good and bad days. Today was just not it.
Okay, it was a pretty good day though. I mean, we went dark. We really did go dark.
I love
Mo
that.
and I went into the pain cave deep today.
I love that. That's my favorite day.
It was so fun.
Even if you can't get your deadlift up, it's fine. It's fine.
I
You'll be
forgot
fine.
all about the deadlifts after those like banded split squats. I don't even know how you remember doing the deadlifts.
Those were, oh, I told Maddie earlier, I said I was not expecting that. I looked at it, I'm like, oh, that doesn't look like it's going to be so bad
Dude, it
Yeah,
was
no.
until I did them. And my ass
yeah.
is like shaking. I couldn't,
Are you sore already?
not right
Yeah.
now.
Okay.
I was like
Not yet, but
swole for like
tomorrow.
an hour at least when we were done with that. I stayed like
Oh
pumped
yeah.
for at least an hour and I like
Yeah.
couldn't walk. And now I feel kind of okay. And it's making me nervous that I'm not going to be sore. If I'm not sore, I'm going to be so mad.
All that work for
I
nothing.
know.
I'm going to be so
I
mad.
want to be sore.
Yeah, all that
All
work
the
for nothing.
pain.
Yeah.
I hate that. When they say
Um,
like, have you seen those like things? It's like you don't need to be sore to have a good workout, which is true, people. But also, I'm like, if I did not suffer that much to not be sore. Like,
yeah, I want to feel it in all the right places for days after the event.
yeah.
So, but you know what? As I sit here and move around a little bit, like, well, I don't know. Tough to say. Jury's out. My 10 secs, I was pretty sure that Mo was also going to use that as her 10 secs. So my 10 secs will be the fabulous news. Alert the town. Sumo oranges are back in stores. It's sumo season. These are the greatest oranges that have ever oranged. Please, when you see at the store the sumo citrus station, buy as many as you can. The uglier and nastier these oranges look, the better. They're the best oranges you'll ever have in your life. Buy them now.
Sumo oranges.
Not sponsored, by the way. Sumo Orange, please sponsor this podcast. Sumo Citrus.
Well, that's good. Great news because Arya loves oranges. So
Oh yeah,
love
they're
that.
the best. They are the best. Please get your hands on those if you see them.
Yeah.
Oh.
Did she tell you about that today? You
I found a
immediately ran.
snack. What
Did
happened?
you immediately run and get those today? Did she tell you
No,
about?
I
Yeah.
just I have these in front
Oh,
of
you
me
just
to
happened.
snack on. Yeah.
Wow.
Love
Wow.
it.
I do too. That's good.
I was peeling.
Oh, now I want a snack. My
Snack
15,000
break.
calorie, yeah, 15,000 calorie day wasn't enough.
You probably burned all that. You did a workout and walked all over St. George.
I did earlier check to see it. I'm at 13,000 steps. So
Oh, nice. Oh man. Okay.
Yeah.
Love that. Okay. So the exciting part of today is we are going to dismantle the medical machine. Mo is going to regale us with stories of what happened when they told her to get back surgery, right?
dun,
Yeah.
dun,
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 dun.
And how I feel now that after I did it.
Yes. Okay. So take us back in time and tell us
Wait,
about.
after you didn't or did it?
I said did it, but no, I didn't.
Didn't. Oh, okay. I got it. I just pulled a fast one. Okay. Mama's quick. Okay. I'm rested, I think. Anyway. Backstory.
Yeah. Take us back in
Oh,
time.
where should I don't know, where do I start?
So
What
why-
happened? What,
yeah.
what caused this back injury to even begin with?
Okay, so we're gonna go back like a million years. It started when I was, I want to say like 13, 14. We had a trampoline in our backyard. So me and my brothers would like jump, do
Yeah.
our thing or whatever. And one day we were jumping and my brother had like double bounced me, I guess, like where they
Oof.
jump
Yep.
so you can get like a higher jump or whatever. But the way that it happened, I flew off the trampoline, like I flew off and I landed straight like on my butt. So all of that pressure went up my spine. I broke my tailbone and I couldn't walk. Yeah.
Stop, because
I
that's one of
couldn't
my
walk
nightmares, like breaking my tailbone or my coccyx or something.
Oh,
But that's like a
yeah, if I
nightmare
find
of mine.
X-rays.
Was-
that's
I did that
intense.
at a very early. Yeah, it was very painful. It was
Oh my
it was
God.
really, 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 really bad.
So time out. So was it broken or
Fractured.
fractured?
Are your brothers
Um,
still grounded?
No,
Um,
no. We beat each other up all the time.
sidebar is there's a girl in 4th or 5th grade, went to sit down and somebody pulled the chair and she sat and broke her coccyx or whatever.
That would be me, dude,
And-
and I would be so embarrassed.
Oh, dude, she was
That's the worst.
she was obviously crying because it
Oh
hurt
my
really bad.
God.
And the
Yeah.
kid got in so much trouble. And like from that moment, I was like, don't ever pull the chair from
I
somebody.
wonder what happened to her.
Well, she had to sit like on the special like butt pillow. I wonder
With
if
the
she
hole in
ended
the
up,
bottom?
yes.
Yeah, I had that.
And she couldn't sit for too long and she couldn't stand for too long. It was broken. And I wonder, she probably had back surgery, to be honest. I don't know. I probably should try to find her on Instagram or Facebook or something. But
How old was she? How long ago? Like what age?
we were
range?
either like 4th or 5th grade. So
Mm.
probably maybe
Yeah.
around the same
And
time,
her
a little
bones are
bit
still like
younger.
developing.
Yeah.
Okay, so you flew off the trampoline, you landed on your butt, you broke your tailbone.
Yeah, and that's just like where it all started. So like throughout the years, I still like, I mean,
Did you go to the doctor
gets
right after that?
Yeah. And it was like the typical, I mean, like, when you're a kid and like it's not like broken, but it's like there's pain and you can't like walk or whatever. It's just like bed rest and ice and the
How do you
typical
ice
like
your butt?
your back, like your low back.
Oh,
Like you put
okay.
ice. But small enough at that time where it'll help.
Yeah.
But anyway, like throughout the years, I still did sports. Like I still did track like my freshman year for a little bit, and then I did swim all of my other years, which like helped a lot. But then I still did like, I got into snowboarding and like I would hurt myself and it was just repetitive
Mhm.
like injuries to my back.
In
And
the same place, the same feeling, the same like
the same feeling, not like the same place, but it kind of like it messes, I mean, it completely like messes you up. Like the pain will always come back. I mean, to this day, like sometimes I have really bad pain. But fast forward to like what really, really, really messed me up was I think it's like 5 years ago, 2016. Is that 5 years ago? Before Joel and I got together, or 2015, before we got together, I was getting ready with my sister-in-law for her wedding. It was her bachelorette party. We were sitting on the ground. I don't know if I told you this part, what like did me in. We were sitting on the ground. I was like crisscrossed and I was curling either my sister's hair or my sister-in-law's hair. And I sneezed. And since I've had like a lot of issues with my back, like I've just had, like I said, issues. I sneezed and all of that pressure like just went to where my L4, L5, where like my injury is, and it just blew it out and I couldn't walk. I couldn't get up. I was crawling. I went to the doctor. I went to go get x-rays. I had a herniated disc and
oh my
just
God.
like, yeah, a bunch of damage, but it's been,
Did it like ruin the
it's just
wedding
been over time.
Oh
Like,
yeah.
it's just,
What happened? Did it
I
ruin the
couldn't-
bachelorette party?
or that bachelorette
yes.
party?
I mean, I still went. I didn't go to the doctor till like the next day. But I went. I
So
couldn't
it didn't
walk,
ruin
like,
the
her
party.
it ruined
She
it
was
for me.
probably, yeah, she was probably sucking it up, but like
Oh my
in
God.
the
Dude, I was
most pain.
crying.
Yeah.
I have a
mean,
really high
yeah.
pain tolerance, but I was very like emotional. I was scared because I couldn't even stand up straight. Like I couldn't, and I didn't want to like ruin this day, which is like so
Yeah.
important to her. And like, whatever. It
So you
all,
went to the doctor the next day and they said you have a herniated disc.
well, I had to do the x-rays first. I had to do
Mm.
x-rays and I had to do like MRIs and whatever. So first I actually went to a chiropractor off of like Green Valley and Sunset. It was like a holistic, I know that face, I know. It was like a holistic one, like whatever. And he did these like adjustments and nonsense. And that's where at
Did
first
it feel good or did it feel
no,
the
absolutely
same?
not.
Oh.
No, nothing
Okay.
helped until I tell you about now with my accident.
Okay.
So so then that's where, like I said, I couldn't walk. Like I literally had to crawl to go to the bathroom, to go pee, to like do
Yeah.
anything. So I was bedridden for like 3 weeks. Eventually, like in that time, I went to the doctor, and I got X-rays. That's where like the L4, L5 was like herniated disc and bulging disc and like whatever, and a lot of like pinching nerves, which is what makes like a sudden movement just almost like make you collapse to the ground because the pain is just, I mean, it's horrible. It's excruciating. It's bad. So it was just a lot of disc damage, but it wasn't just from like the sneeze. It was just over time that I'd never like gone to get checked or like taken care of it or like really focused on strength training more so. So eventually, like over time with like anti-inflammatory and like icing and like whatever, eventually like it gets better. Eventually like the pain subsides and you can like move. You can you're better. And then fast forward, there's always like pain here and there. Eventually Joel and I are together, we're out doing stuff. And one day I was actually getting out of the bathtub. And the way that I was getting out of the bathtub, just the movement, just like the way that I got out, that pain, that like pinching pain came back and I like collapsed in the tub. And I was like, the pain was just, it was horrible. It was bad. I was crying. I had to go get checked again, and that's when I did the x-rays, and it was like even worse. And then they were talking about starting first with spinal injections. So I did spinal injections for I think like 2 years every 6 months.
Where was this? Like what doctor was this that you went to?
This was at
Name names. I'm just kidding.
Yeah.
Name names. Girl, I don't even know
I
my
want their
dentist's
credentials too.
name.
Actually, we'll put a link to them on the links
Nevada
below.
Spine Center off of Smoke Ranch was where I did this stuff. And I think that's where the doctor was too. Nevada Spine Center. They have they have like their office where they see you for like injuries and stuff, and like in the building right next to it is where they do
surgery
procedures like injections and stuff, but surgical stuff would be in a hospital.
Okay.
But it was a Nevada Spine Clinic. Nevada, whatever. That's where you
Nevada Spine Clinic.
Yeah.
On blast. Okay.
So I did the spinal injections, and that stuff honestly it doesn't even work. You don't
They were
feel it
injecting
helping
what?
you.
Like cortisone?
Cortisone, some steroid. It was it wasn't cortisone, but it was something similar to it. But since I was so small, they had to put me under, so I was like under for everything. So again, I did that like every 6 months. And honestly it didn't really help, and they would tell me, or the doctor that I had, don't ask me his name because I don't remember, would tell me that I couldn't like run anymore, to like minimize lifting and all of that stuff. And that's when I was at F45. So it was a lot of like jumping and more cardio than like weightlifting and stuff like that. But I've always been afraid of my back, like deadlifting, doing anything with my back. I've always been afraid because something so small like getting out of a bathtub or picking up
Meanwhile,
a book.
I mean, running and jumping at F45 is actually just equally as dangerous as lifting.
The deadlift.
Yeah.
Exactly. Right. But I also didn't know. Like I was
completely.
It's freaking.
It was embedded in my head, like, don't do this, don't do that. You're not gonna walk again. You mess this up because of like the nerve damage and the risk of these needles going in your spine and like being paralyzed. And like you sign all these papers, dude, like all these papers of like the risks that you're taking.
I'm cringing at, like, I can't, my blood is boiling.
Yeah, I mean, I feel like I'm like kind of going in circles, but it wasn't getting any better.
Mm-hmm.
Like things kept hurting. I mean, ask Joel. Like I would literally, he would watch me crawl to the bathroom to go pee,
He would
Oh
or
help
my
he
you?
would
How
try
God.
to help
rude. I'm
me
just kidding.
walk. Well, he would try to help me walk,
And
and he would move me like some way,
then he would
and
hurt you, and
it would
his
hurt
fault.
me.
It was his fault. I just,
No, there were times like it hurt him seeing. I mean, it hurt him seeing
yeah.
me that way,
Oh,
like
yeah.
being helpless. And
Uh,
then aside from that, they tried to like drug you up in just like pain
oh,
medication.
yeah.
That's
Let's
where I
talk about
started
that.
getting real pissed. Okay.
Let's talk about that for a
Yeah.
second, because when she told me this, well, I'll just let you speak.
Yeah. So in the mix of like the injections and like therapy and telling you you can't work out anymore, you can't run, you can't like whatever, also drown in this medication, I had to sign in the very beginning, you have to sign like this, go through this booklet that's like an inch thick, because it was also during the time when opioids were like in the news like 24/7, all the overdoses and like stuff like that, you know. So you have to sign and go through all these papers for the medication that they're going to give you. And they prescribed me they gave me a couple of different things. They gave me like Norco, they gave me I think it's like hydrocodone,
What's Norco? Is that a painkiller too?
Percocet. Yeah, they're all like
Oh my God.
They're
they're
all
all
pain.
pain
They're all pain.
medication.
Yeah.
And they gave
It's
you
all pain
3
med.
of those. Those are the 3 big ones.
Yeah, different ones, and like anti-inflammatories and stuff. And you have to sign this book like that says you're not gonna sell it, you're not gonna give it to people, you're not like whatever, and all of this stuff. And so they sent it, and like I picked them up. I was like, okay, maybe if I need 1 or 2. And the very first time I took one, I'm very controlling. Like I like being in control of my body. And I had taken, and I think maybe it was one of like the Percocets, because like the pain was ridiculous. And I was numb. I laid on the bed and I could not move. And I didn't like that feeling. Like a lot of people do get addicted to that. And a lot of people, I mean, fall into that. But I couldn't. I didn't like it. So I was like, yeah, that's not for me. Like ibuprofen, 800s and stuff like that, whatever, like that'll help me. I'll take that. That's fine for a little bit. But every time you go into your checkups, you have to do, they do like your refills. It's just part like they do your refills. But you also have to take
a urine
urine samples to make sure you're not like abusing and stuff like that. So I'd go in, they're like, how are you feeling? Check your back, go through your x-rays again, this and that. What's your pain? Is the medication helping? And well, I'm not taking it. Like I bear through it. Well, the medication will really help you if you take it. They just want you to take it to Maddie.
It's just so messed up. Like it pisses me off. And I have a whole rant I'd like to go on right now about nurses.
I probably could go on the rant with you, but
well, my rant for this like never ends, like never, because I was there. I was on the end of where they tried to push this stuff on me. I didn't like the feeling, but you're gonna do this to somebody who like isn't necessarily as, I don't want to say strong, but pain tolerant, I guess, that doesn't want to take it or need to take it. But you're pushing this, like you were pushing, hey, don't get addicted to this stuff, but here's some more refills, like go pick them up. So anyway, so like I went, they would take like my urine samples, they're like, okay, you're good, the refills will be ready. Well, I don't need the refills, like they're still full, I don't need them. Well, they're going to be sent, so they'll be ready for pickup and this, and it's just like that's how they make their money.
Drug pushers.
I mean, that's how they make the money, is by not actually fixing you, drowning you in medication.
1,000%.
100%. It's that. So, okay. So I want to talk about like, what do you remember about your care providers at the Nevada Spine Clinic, or when you would go in for these checkups, like, and these people that would prescribe you medicine, like these healthcare professionals, what do you remember about them?
Like their attitude, like their way
just
of
them, like, I mean, yeah, really, I mean, like care. You interacted with a lot of them.
Yeah. Usually, so I'll be honest, usually like the front desk girls, like the office, the checking you in, were always like fine and helpful or whatever. But when I went to the back, like the the doctors and whoever else, it was just like, they don't care about you. I feel like I've never liked going to the doctor. I've never liked,
Yeah.
I like going to the dentist and that's it. But I don't like going anywhere else.
The
I just
dentist.
don't.
I know. I like the dentist too. I'm with you
I
on
love the
that.
dentist.
I love the
I do know my
dentist.
dentist's name. She's the best.
But that
Positive shout out. Who's the best dentist?
But no, I don't know. I can't really like, I just don't have
So
great,
when did you like kiss this whole thing goodbye?
when I officially stopped was before, a couple months before COVID, like was a thing before it happened.
Okay.
I had started really getting into like F45, which is like a small like hit type franchise. And I actually felt a lot better moving than
Right.
I did not moving. So I listened to the whole like, don't do this, be careful. Like if you're gonna do anything, you get on a bike or walk. Like don't run, don't do any of that. So I listened to that for like a little bit because I was afraid, like I mentioned, of like making myself worse.
Yeah.
And they said
But
that you had to have surgery, right? They told you.
correct. It's a spinal fusion for the disc damage. Yeah.
They were like,
And
so that was what they were
I
ultimately
didn't.
selling is like, these are drugs to
Yes.
pacify you, but ultimately you're going to need
You need
fusion.
to, yes,
Shut the
yes,
fuck
Yes.
up.
yes. And she was
And
how old? You were
5 years
20,
ago. How old am I?
20,
23, 24?
yeah, yeah,
I was
young,
young.
young,
Yeah, really,
this
really
young
young.
20-year-old that could have went in and had this like,
Yeah.
bro, what?
So
What?
where I was working and like I had an
Oh,
office job. I was like, I know, I think I told you this part. I sat on my desk 8 hours a day. Like sitting down is more painful for me than like standing and moving. Like I bartend in cocktail now. I'm on my feet 24/7 and my back never hurts. When I move, like I feel good. When I stop moving or stop working out for a week or two, it sucks. Um, Back to work, I had like a desk job. So it kind of like helped with like limiting the movement, limiting like movement and stuff. But I had a coworker. She had like neck pain and stuff, and all of this was, we were like dealing with our pains around the same time. And I'm not gonna like say her name or where I worked. I don't know if that's allowed. But she went in to have a procedure done on her neck, which was also fusion. Like I said, in the same time frame that I was dealing with my stuff, and they were telling me
She said you were about the same age?
She was maybe, so I was 23, 24 at the time. She was maybe what I am now, like 28,
Okay,
29.
so yeah,
a
babies.
little, yeah, 20s.
Yeah.
Young.
And one day it was like, hey, I'm gonna go in for my procedure, just like me. I'm gonna go in for my injections, a normal day. And after that, she is now, and I don't know if she still is, but I know it's been a couple of years that she dealt with it. I just haven't followed up. But she became quadriplegic.
Oh my God. I was
Yes.
I was like dreading. That was like the worst thing that you could have said, and I can't believe you just said it.
No, yep. I mean, I'll share with you guys like
breaks my heart
outside of this, but no, she became quadriplegic. She was flown to like Colorado or something like that to go through like therapy, and the doctor she had was actually like a regular that would go into her place.
I don't even know what to say. I'm just like I'm like so brokenhearted about this story right now. My stomach is in my.
What makes me even, it's just it's sad because she was 20s, like this young little, like, not saying it's right at any age, but
this girl had like the best
young.
attitude.
Yes.
She had neck
just
pain.
young, like neck pain.
And they fucked up in surgery.
Yeah. I mean, it's definitely like a risk. I mean, like any surgery, anything, anytime they touch you, it's always a risk, right? Like anything could
But
happen.
it's like how horrifying for that to have happened when you're supposed to be in the hands of the people who make you feel better. Like, not saying that doctors aren't like I always say, there's a time and a place for Western medicine and what it's capable of, and it's amazing. But at the same time, like,
of course,
this isn't that. They ripped this girl's like agency away from her by this dumb ass procedure that doesn't help. Even if it works, it barely helps.
Yeah. And I had debated long and hard. I had to call like my dad, my mom, and talk to Joel. I talked to everybody. Like the pain that I was going through was, it was
So
unbearable. Like
intense.
I couldn't handle it. And I didn't want to drown in medication. I didn't, but I wanted to be fixed. And like they're selling you this story that you're gonna be fixed.
And these are
Like,
the
sure,
people,
it's
these are the most
risky.
respected people. These are medical people. These are people in white coats, doctors. We're
Yeah.
like trained to respect these people. Like they know more than we do. They fucking don't.
Right. And they talk about the new technology and all these procedures. It's like less
It's not
invasive and
invasive.
like all
Yep.
of this
Oh,
stuff, all of these things they sell you. And I had the conversation like, I think I'm gonna do it. Like I think I'm finally gonna do it. And not too long after that happened, and I said, absolutely the hell not.
oh yeah. Yeah. Yeah.
Oh my
Um,
God.
I hate that, but not to like take the spotlight off of you, but I
No.
remember when Maddie knows my shoulder was so hurt to the point where I was like, surgery was absolutely like the last, like worst case scenario. I'm going to have surgery. Like that's where I thought I was headed, but I would have done anything before having to have surgery. Like you could have told me like stand there and go like this a million times a day, and I would have done it just so I wouldn't have had to have surgery, because that is the last case for me. You know what I mean? But some people are
Yeah.
just so quick because, like you said, these well respected doctors that we're supposed to be trusting with our lives and whatever are saying, you need surgery. That's the only way it's going to get fixed. And then stuff like this happens. And it like, it's just, it makes me like sick almost
Mhm.
like just disgusted. Like, ugh, ugh.
I think it's also like the more you know, the more that you like know about these things that can happen, or if you know people that have dealt with back pain, because like me, my oldest brother, my dad, they've all had like different back issues like scoliosis or like whatever it is, and like never went through surgery because that's something you don't want to do. I feel like if I were very naive and like unexposed to all of that, like if I didn't know what the risks were and they just really sold me on like on this technology and this, and like I knew nobody that's ever dealt with these issues, maybe I would be like, okay, like that's gonna fix me, let's do it.
Yeah.
Ugh.
And I also think that there's like another category of people who like love being told that like they need a spinal fusion and like love the idea that they have to like
To have
be wheeled
surgery,
into
like
surgery and like
they're like a hero because you have surgery. That's what my dad always says. Like
yeah,
they're a
Yeah.
hero. They're like a
yeah,
hero because they had surgery. Like
yeah, exactly. And so it's like they're preying on that too, and like just the whole situation. Okay, so like that was like you said goodbye in like 2020, early 2020 to the whole institution, Nevada Spinal, whatever you said, sayonara. And then you started doing CrossFit.
So August, it was like August 2020, and that's the date because they sent me. It's funny we talk about this because I just got the I guess the bill from the procedure from 2020, the last time I did the injections, saying
Ew.
that my insurance ended up denying the final one. Like
Ew.
it's like a $6,000 bill. I'm like, oh, I'm whatever, deal with that later. But
ugh.
August 2020 was the final injection that I did, because honestly, like they weren't helping.
Yeah.
Like they tell you it might take up to like 3 weeks, 6 weeks, 3 months, whatever. And again, it's that illusion that it's gonna help. It's
Mm-hmm.
better than surgery.
Mm-hmm.
They're giving you like a steroid or like whatever, like
Yeah. And
it's
six
gonna
thousand
help.
dollars they're collecting for this
Yeah.
thing
That
that's
too.
not working or might work, and who knows, 3
What helped
months,
me
8
was
years.
exercise, like strengthening my back and moving is what made me better.
Yeah.
And then I felt, because at that point I had done a 45 for, I don't know, I think maybe a year and a half, like on and off, and I wanted more. So I had actually called the CrossFit gym that I go to now, and the girl that answered, we're now like friends. Her name is Molly. I asked her, I said, listen, I've always wanted to get into CrossFit, but I'm gonna be honest, like I've been dealing with like back injuries and whatever. Like I'm mortified, like I'm scared, but I really, really want to also like I need to strengthen myself. Like I need to strengthen my back because that's what makes me feel better. That's what's keeping me moving rather than like sitting and not doing anything that causes me more pain. So she was actually like, had it been someone else that answered the phone, I don't know, maybe I would have never walked into that gym. But she said, listen, I've like, I'm not an expert and I'm not like, whatever. I do coach and I do like, you know, your body, you know, like what you're capable of, you know, what your limitations are and stuff like that. Um, a good coach can always like work with you and help you like get better as long as you express your injuries and stuff. So like they know what works for you and whatever. So she invited me in to do like a trial and then do like this onboard to go through like all of the movements and stuff. And it was great. And if but I was still so afraid to deadlift because I had done deadlifts at the other gym, so like way lighter weight. Like it's at 45 is like nothing like CrossFit. The weights are maybe a quarter, like 25% max of what we do there. And it was always the deadlifts that kicked me out for like 3 weeks or a month or whatever. Like I couldn't walk because the movement, something would happen there. And it could have been form, it could have been, you know, a bunch of things because I wasn't as good as I am now with my form, you know. So that's when I went into CrossFit. That's when I said like, okay, this isn't helping me. Like I am done. I'm not going to do surgery. I'm not going to take pain medication. I am not going to do injections. Like I'm not doing any of that. I'm going to move. Like if you're going to keep telling me that I need to be careful because I'll probably never walk again if I injure it again and whatever, you know what, then I'm going to do it doing something that I want to do, that I like doing. I'm not going to just like be afraid and not go hiking and not go, you know, do what I love just because of fear.
Right.
And I just started getting better.
Yeah.
Way better.
Yeah. Okay. Well, you know, this is very tip of the like on the forefront of my mind because I went to, I have a friend who is getting a knee replacement. We know. Okay. We know. But she invited me to come with her to like the, like they put on like a seminar, like an hour and a half class. They called it joint class and they taught us everything we need to know about hip replacements and knee replacements. So my friend is getting a knee replacement. Turns out my family friend just got a hip replacement.
Oh
Had
my
it this weekend.
gosh.
I know.
I can't.
But so like it was very interesting for me to like experience this class because I have a very similar story to you, Mo, in the sense that like when I learned the gospel, I was at a point where it was like my back was like beyond. So like I understand that type of pain, but that was the last time I experienced that was probably, what do you think, Laura? Like 2017, maybe 18 ish.
Yeah.
I haven't been to a real doctor since then probably. So this was like my
the
first
dentist. Yes.
The couple times doctor. Actually, couple crowns in between.
A real doctor though.
But so it was like it was a whole new perspective going into that arena, like now, knowing what I know mindset, now and being who I am now. And I have a lot of fucking feelings. I'm just gonna rant about them for a second.
Hold on, can I ask you one thing though?
Yeah, please.
Did you, and I personally struggle with this a lot, but you're a little bit different than me. So I'm not as stubborn because you're not, you're an April Taurus and not a May Taurus. I'm just kidding. But did you go in with like an open mind about it? Like,
no.
I mean, I actually always have an open mind, like 100% of the time. I consider myself
I do, and I say I do, and I don't.
I am very open to having my mind changed when somebody does a really good job convincing me that they're right and that I should reevaluate my viewpoint. I have no problem doing that. In fact, I really love it. Being proven wrong is one of my favorite things because it so rarely happens. Okay. So yes, I had an open mind in the sense that I always have an open mind, but I also felt just as educated as these people. Like if I had questions, I was going to ask them and they were going to be like I wasn't just going to sit there and
I wish I could have been a fly on the wall. I'm
going to ask questions. I'm going to push, like, I know what I'm talking about. And so we're going to get to the bottom of this. But I am just trying to like, I try to be an observant Like, I don't want to put
Uh-huh.
my filter on it too much. I know what my filter is, so I try to be aware of it and block it out and just take
Okay.
the whole thing in for what it is.
In my elderly age, it has been a struggle for me when people are like, I'm gonna have a knee replacement. And I'm like,
Well, I mean, yeah, I mean, I'm sorry. It's everything in my power to not even like I'm mad that I'm there that they're even getting a knee
yeah,
replacement,
yeah.
but I know
But
where to
it's cool
spend
though.
my
This is
energy.
cool. This is cool. This
Yeah.
is cool. Okay. So we'll get on with
But
it.
so here's the thing. Let me describe first the average person in that room. I would say they were like older, like minimum 60. Tough to say because I feel like so many people can look so much older than they really are, but I would say probably nobody was younger than 60. There were like 4 people in total in the class that were going in for surgery, and each one
How
of
old's your
them
friend?
74, I think.
Oh, okay. Okay. So
Yeah, but a very sprightly 74. She was the sprightliest one in there, that's for sure. But what struck me as really sad was just like that these people were already having such a hard time moving, and they were about to undergo such an intense procedure that was going to make it even more difficult for them to move. Like, and a lot of times, like they're describing like the things that they're going to need help with, and I'm looking at the partner of the person who's like their helper, and I'm like, the helper is going to get hurt helping this person. You know what I mean? Like, none of these people are fit for this. But here's the rant I really want to go on. When I go into places like these doctor's office and these health professionals want to give me advice, and it's like, I'm looking at them and it's like, hospitals are no better than the DMV at this point. The average person that you see behind the desk at a DMV is about what you're getting in our healthcare institutions. It's really fucked up. Not one of those people that I saw in that room was I confident had any idea how to execute a healthy lifestyle, has any idea what a healthy joint feels like, or has any idea how to actually help a person. Not to say that they weren't caring, because I will say that like I felt like they all really cared about the patients. Like, they were doing the best they had with what they knew. And there was a wide demographic. So like there was one lady who was helping. She was like kind of older, fat, obese, just like morbidly overweight, could barely walk herself. She was serving me a salad. Like, I felt bad that this woman is like serving me a salad at this class when I'm like, I'll help myself. Like, why don't you sit down? She's the one in charge. Okay. So she's the healthy one. They had one nurse who was like, I felt like, okay, this is my nurse rant, because God bless nurses. Okay. They're like the backbone, right? And they deal with the brunt of like the worst of healthcare. And they're the ones that get like the doctors, they can just like fuck around and do doctor things. And the nurses have to be like on the front lines. And so I have an immense respect for nurses, and they deal with like people in their most vulnerable state, and they should be respected. But also this nurse, okay, I'm stereotyping. I'm going to put on a big, I'm just a judgmental person, I guess, but you really can learn a lot about a person just by looking at them. Okay. So this chick, probably like maybe our age, 30s. I know for a fact this chick does CrossFit. She had a Hydro Flask. It was covered in stickers. One of them said CrossFit. She had the look, you know what I mean? She just looked like a CrossFitter. So she was the one where it's like, okay, so this chick is like kind of into health, right? The sad thing is like, she obviously doesn't know shit about health, because number one, she's doing CrossFit. So her deadlift probably sucks. Like, she is probably like, I'm immediately stereotyping and categorizing her in the category of CrossFit people who like do CrossFit and love being all intense, and like they're super empowered by CrossFit, but they're also like not doing it right. And they probably don't have good coaches, and people in those classes are getting hurt and sent to Miss Chick over here at the knee replacement clinic. Okay. So that's not health. That's number one. But this chick gets to walk around, Miss Nurse, like she does CrossFit and she's healthy and she does knee replacement. So she understands what like medicine and helping people is. I have a problem with that right off the bat. Number two, that's the healthy one. Okay. That's their athlete. That's their number one player. That's not their physical therapist. This is the whole reason I'm at this thing, right? Because we're supposed to be getting coached on like movements to help the patient after surgery and like to help prepare them. This guy had like maybe 15 minutes of the 90-minute presentation. I don't want to be mean. I do want to be mean, but there's just picture like a red potato, okay? and he's going to spend, the red potato is going to spend 15 minutes in shoes with soles this thick, telling you
Stop.
how to fix your
Stop.
knees, your back, and your hips. And it's like, he didn't even give us any exercises. He pretty much just showed a slideshow of like the place that like you're gonna go and like learn to walk. Essentially, learn to walk is what they're gonna do at physical therapy. Learn to bear your own body weight, and that's all they're gonna. That's once you can do that, you're pretty much done. Walking and bearing your own body weight is like the bare minimum of what people should be able to do. Like PT isn't over until you can deadlift your body weight, and that's not what they're going with these people. The number one takeaway from this whole presentation was that the best way to support this knee replacement, this incredibly invasive surgery that's going to throw a wrench in you and your loved ones' lives,
rock your world,
is to strengthen before and after the procedure. It's like I'm taking crazy pills. It's like, why don't we just skip the procedure then and just do the strengthening part?
Yeah.
Because that doesn't make any money. And that's the end of that's like the end of the game. That's all it's about. And I feel like it makes me mad that like people like Miss CrossFit Nurse.
Did you talk to her at all?
Not really.
Oh,
not really.
I would have loved to hear. Okay. So did you ask any questions? Or
I did ask one question because the PT guy, he was telling us to do pretty much swelling protocol, like straighten the leg, like bend the knee and then straighten the knee and then bend the knee and then straighten the knee, and just like little movements like that, and like do that. So okay. But then he said to not rest with like a towel under the knee with the knee like bent. So I was like, well, why? Like, you want us to bend the knee. The whole goal is to bend the knee and then straighten it. So like, why not rest in that position? And he just said that it could be like kind of loose. I mean, like I do kind of get it. That's the only question I ask, because they didn't get into anything really exciting. I mean, he just showed the facility, and he there was literally a printout sheet with like some pictures of exercises, the same way you would get if you Googled like knee exercises. It would give you, a little graph of a guy doing like a foot thing or whatever. Like, there wasn't anything to really dig into. And for me, it was more like, it was just an observation. Like, I wasn't there to go in and like light any fires and change anybody's mind that day. But I did want to see like what was about, and like CrossFit Nurse is a good example of somebody who like, it's like a tragic character in the story to me, because it's like there's somebody who wants so desperately to be doing it right and is a victim to the system doing it wrong. This chick obviously cares about health and moving and like helping people. She very clearly cared about everybody's comfort and like wanting to get them through the procedure. Like, you don't just become a nurse because you don't care about helping people. Like, that chick has everything that should make a really good, helpful person. But it's sad to me because like what she's actually doing isn't that helpful at all. In fact, it's contributing to the problem. Sad.
Yeah. It's just, it like you said, it all comes back to money.
Yeah. So now tell us, Laura, about your recent doctor experience when you brought Aria to the doctor.
Aria's a little bit different.
It is a little bit different, but like tell us about your experience, like, because that's like your latest experience with like healthcare professionals. So like, talk to us about it.
Well, Aria was still allergic to a lot of things. So we could not get her certain vaccines because certain vaccines had what she was allergic to. When we were in Vegas, it was just absolutely hounding us for vaccines. Like,
really?
Well, she needs this vaccine and she needs that vaccine. And it was like, I am not doing that, because the last time I did that vaccine, she was allergic to something. She had the allergic reaction and my child wasn't acting normal. They're like, but that's normal. And I'm like, no, my child acts normal when she acts normal. I know it's normal. And that is not normal. That's not how my child is. Long story short, we moved here. We just recently went, and the doctor was just like, just completely different, like mindset, and was like, yeah, like she, like we don't have to do whatever vaccines you don't feel comfortable with. Like, it's totally your call. Like, you know, like, and not even
Wow.
about like, it was just completely different. Like, it's totally your call. Like, she doesn't need any, since she does have this like allergy, she is medically exempt from getting vaccines. And so like when she starts school in a few
Mm,
years or whatever, they can provide a medical note because she could possibly die if she has these
mm,
vaccines or whatever from her allergic reaction. So it was just so different. And
wow.
I mean, I would go into her appointments in Vegas and I would be ready to fight. Like, yes, come at me. And they would tell me, they would be like, well, you know, and they would like pull out like a whole list of like vaccines that she hasn't had yet. And they would be like, you know, she could die, right? Like, so that's what she could die if you don't give her these vaccines. And I'm like, she could die if we give them to her. Like, what are you not understanding? Like,
Yeah, you
and
could
Dennis,
die if you keep talking to
yeah,
me in that tone.
the one time the like, I don't know if they're nurses, they're probably like medical assistants because it's just like the doctor's office. She came back times, three times
Dude.
to ask me three different ways. And by the third time, Arya was like maybe 6 months old. And so by like the third time I had lost it. I was like,
Wow.
I just lost it. And Dennis was like trying to like escort her out of the room. It was like, you need to go. My wife is gonna lose it. Like I had already lost it. I was like going off, like just going off. Like I was like, if my child dies, what do you care? She's not your child. She doesn't go home with you. If
Yeah.
something happens to her, like worse, like she's brain dead or whatever, you're not going to take care of her.
Mhm.
I am. So if I think this is the best thing for my child, then it's the best thing for my child.
Yeah.
And we're not going to do what you say to do. You're just a medical assistant. Get the
Dude,
fuck
and
out
they're
of
on a
here.
power trip. You know what I mean? Like, I swear,
Yeah.
like it's the same thing as like these people who want to go under and like get surgery because it makes them a hero. These nurses fucking power trip because they just want to tell people what to do. They just
Yeah.
want to take new moms and like
Yeah.
power trip on them. I'm not fucking kidding. I
And
swear I've had it with these
and
people.
it's so easy because you are this like new mom. Like I
Yeah.
remember like second guess. Also, this is a podcast for another time, but like
Yeah.
mother intuition is so real. Like you
Yeah.
just know in your gut, like you just know that it's not the right thing to do. And I just knew, and you were like, nobody was going to change my mind. Not one person was going to change my mind. I don't care. Dennis could have told me something and I would be like, no, dude, this is my kid right now. Like, we are fighting. I will go down till I die. Like you're
Yeah.
not touching my kid. And you just know. And like they just come in and they try to scare you. Like they
Yeah.
try almost make you second guess your decision. Cause there was a couple times where I was like, maybe I should do a little bit more research on this or like maybe whatever. And it's just so, like I don't know, like scare you and tell you like your kid's gonna die or your kid could get this. They could be in
Yeah.
the hospital for, you know, whatever. And I'm like, but they could get that if they get the vaccine. So like
Yeah.
what's the like where's the line? Like
Yeah.
I don't know, but when we came out here, it was just totally different. So we had taken her to her 2-year checkup and the doctor didn't even bring it up. He didn't even say like, you know, like we realized she doesn't have these vaccines, whatever, and she's not vaccinated for this. They didn't say one thing. It was actually Dennis who asked.
Really?
Um, yeah, because um we were talking about her going to like she has to be 3, but we're talking about like a daycare. And so I was like, I don't know, like, do they need certain vaccines for like daycare or whatever? It's like preschool.
Okay.
And he was like, yeah, she does. But since she is allergic,
Oh,
she could
medical
have
exemption.
yeah. And he didn't say like, but these are the ones that she could get or, you know, like whatever.
I
Like,
love it.
I know. And you know what also I love is that he comes in, no nurse, no like medical assistant. It's him. And he like always like he remembers. Like I don't know how,
Yeah.
I mean, it's a kid, you know, pediatric place. I'm sure he sees like, and maybe they just put it in the notes and he just like, yeah, Aria and Laura, the crazy mom. I don't know, whatever. But he like always asks me like something about me, like
Yeah.
just something about like, oh yeah, so like, are you gonna go snowboarding this winter? I know you didn't get to go last winter. Like it snowed. Like and like just something
Yeah.
like little like
They
that.
keep
And I'm
notes.
like, yeah, yeah, oh for
Bedside
sure,
manner.
yeah,
They do.
and just very very personable. Like, and I love that. You know, like whatever, keep your notes, but like make me feel like I am
On that note, just a quick sidebar because that reminds me, my same friend who I'm with at this knee replacement thing was diagnosed with cancer like a handful of years back. And of course, like all the doctors like pushing all types of like cancer treatment on her. she actually went out to St. George and got like a doctor there who helped her with like her lifestyle and got her like eating better and like working out and sleeping right and like that stuff. And then she was declared free of cancer like after a couple years of treatment with him. Yeah.
Oh,
So
wow.
she gets a
I
little
hear a lot of those
on the
stories.
knee replacement because, but it's making me think like if anything really happened to me, God forbid I ever needed help like that. Like I would be real picky about where I sought help.
Yeah. And it's just, it
Sure.
is so, like scary because like these doctors, you want to trust them because, but
Yeah.
also like,
Well, it's
can
also one of those
you
things
like,
about being like an adult human. It's like you do want somebody to have the answers and you do want to feel like you can go somewhere where somebody's going to take care of you. And it's like,
I saw this thing. I'm gonna have to find it and send it to you guys. I actually don't know why I didn't send it to you because it was right up our alley. But it was this doctor who was like talking about how he was in med school, and he's like, I think back to when I was in med school, and they would be like, "Oh, you have strep throat. Here, take this. Oh, you have this, take that." Like instead of being like, okay, but why did you get this? Like
mhm,
let's treat the cause and not the symptoms of what you
right.
have. And so he said that that's why he ended up going this direction and all of the other doctors went the other direction
Mhm.
because he was like, well, why does this keep happening? Like what
Yeah.
is the reason? And so I'm gonna have to find it because I didn't end up watching it. Something probably happened with my child. I don't know.
Mm.
But it was really cool that like he said that because I was like, that kind of gives me a better insight into like how these doctors, minds are
Right.
thinking.
Yeah.
Um, and just like, I don't know, it's just so crazy because like even recently Aria was kind of sick. Actually, she was sick. And my mom was like, just take her to the doctor and just so you have a peace of mind. And I'm like, I have a peace of mind. I told you what she's sick with. Like,
Yeah.
I know what she's sick with. And my mom was like, no, the doctor, like, whatever, the doctor could tell you what she has. And I'm like, yeah, I'm telling you what she has. Like, whatever. So then Dennis is like, well, I called the doctor and they said that it's probably this, but if we're still concerned, we could take her in. And I'm like, I told you that's what it was.
Yeah.
Like, I know I don't have a PhD, but I know how to look things up and figure it out for myself. Like, I don't know. Anyways, long story short, we ended up taking her to the doctor because my mom hounds me for everything. It's fine. Teresa, I love you. I love you, Teresa. If you watch this, she won't, but if she does. But it's like that. Like they needed to hear it from
Mhm.
this doctor when I'm already telling them what it was. Like,
Yeah.
and
Yeah.
it really was kind of frustrating to me. But
Did
it's
you
fine. I'm over it
experience
now.
that with your like spinal injections or like the nurses with the medication or like if you would push back that they would try to like incite some type of self-doubt in you, Mo?
Yeah,
Really?
all the time. And that's why I doubted it. That's why when I mentioned that there was a point where I felt like I was gonna do it, like you know what, I'm gonna do
Right.
it. I'm gonna do the surgery is because they had done that. Like they had made me believe like this is the best thing for me. This is what's gonna help me. Um, because clearly the injections weren't helping and
Right.
nothing else was helping. Like I wasn't gonna drown in medication. I wasn't gonna drown in like, you know, that's that was it. I was
Yeah.
convinced that that was it. I was naive and thankfully like I am so grateful and so thankful that I never did it.
Right.
Unfortunately, like it was a someone else's tragic incident that like
Yeah. Yeah.
Yeah.
made that decision for me. Like, no, I'm not gonna do it. Like there's no way. But that's what it was. It was definitely like they make you feel a certain way, either bad for not taking care of yourself or that you know that it's their job.
Mm-hmm.
You know, they
Oh,
go to school and they become these people who like they do save a lot of lives in certain areas, but they also make their money by fixing, you know, by fixing.
I could
Like think
understand
of it, yeah,
like I always say, like sometimes like Maddie says, like sometimes there's a time and a place for it, right? Like if you were in a car accident and your back was you need complete back obviously like you
You can't
gotta go and
manifest
do that.
that. Yeah.
Right. You
Yeah.
gotta go and do that. Like,
you
Yeah.
but
break your
something is
leg or
yeah, like something like obviously that stuff, yes, doctors absolutely. But like injuries that can be taken care of.
Everyday health and well-being does not happen inside of a doctor's office. It never,
Right.
ever does. And
Right.
pain, most chronic pain, almost all chronic pain of every kind, almost all of it can be fixed within yourself. Like, there are things
Yes.
that you can do and measures that you can take that have nothing to do with a doctor's office and a prescription that can help those issues for you. And like joints and bones and that type of stuff, 99% of the time the answer is strength.
Yeah.
And there's other
I
stuff
w-
too, like cancer. I'll go on cancer tirades where
yeah.
it's like, I believe you can give yourself cancer, and like
Yeah.
digestive issues, and like you can manifest that stuff. You can.
Oh, 1000%.
I will say though, like on the topic of like pills and stuff, when I had my daughter, I had a C-section, and my gosh, they were trying to like, not trying. Well, maybe they were trying. I don't know. I was,
No, just kidding.
they were trying to fucking piss me off. No, I'm just kidding. They actually did piss me off. But it was just like this whole thing. I had like a reaction to the pain meds they had given me during the C-section, which I'm not surprised because I am very sensitive to pain. I can't take anything more than an ibuprofen or else I feel really sick and like just break out in hives or whatever. And I told them that, but like obviously I'm having a major surgery. Like they have to give me something,
Yeah.
which is fine. But also I I did not want to take anything after the surgery or after I was like recovering. One, because I would either knock out and like be a zombie,
Yeah.
and I'm like trying to like be
You don't
with
want to
my
miss the
newborn.
first
Yeah,
like hours with your daughter.
exactly.
Yeah.
And I'm already like numb because, I had just had the surgery. So I'm like numb half of my body. And I'm like hives, itchy and vomiting and dry heaving or whatever. Um, and then they prescribed, I don't even remember, whatever. And I was like, I'm not going to take it. Like I straight up told them, like, I'm not going to, like, whatever, to take home.
Mhm.
I told them I wasn't going to take it. And they're like, well, you're going to need something. And I was like, I'm not going to take anything more than an ibuprofen. So if you give me anything more than an 800 ibuprofen, I am not taking it. And Dennis was like concerned because he's like, well, you just like, I just saw like your guts.
Sliced
Like,
open. Yeah.
yeah, are you sure? Like, I don't know. And I was like, yes, I'm not trying to take care of my newborn child and be like on dope. Like,
Yeah.
dope. I sound like my mom, but it was just, and so
But it
they
is.
prescribed it. They prescribed it anyway. So they prescribed 3 refills of 800 ibuprofen. So I got my one bottle of 800 ibuprofen, 3 extra ones.
I don't know anything about like much about that, but like wouldn't like if you're taking like dope,
Yeah.
wouldn't that like get in like you when you feed the
Okay. So I was going to
And
get into that too.
breastfeeding. Yeah.
So when I was in the hospital, I was in pain. I'm not going to lie about that. I was in pain after I had Arya. And Dennis was like persistent, like trying to get me because he's like, you're
you're
hurting.
dying? Yeah.
And so the lady's like, okay, if we give you this now and you're going to nurse your daughter, then you have to wait this amount of time. And I was like, now you're adding a whole math problem on top of my painfulness. No, just no. I'll take the pain to feed my daughter.
Mm-hmm.
I am not going to sit here and now do math
Mm-hmm.
and try to think of like, okay, well now this and now my daughter, like,
Or risk
I,
your child becoming an addict.
I'm
Yeah.
not doing it. I'm not going to do it. So then they like gave all this ibuprofen, which was fine. I don't care about the ibuprofen. Like I didn't even finish one bottle of it. I don't even think I didn't take any actually when I got home, but they prescribed 3 bottles of like Vicodin. Yeah.
Yeah, they do that.
We were cleaning out the bathroom and I still have the full untouched bottle of Vicodin
Oh,
in our bathroom.
side for me.
Because Dennis filled it for me because he thought that I was going to
He
need
was
it.
like wanted to have it. Like I guess I get it. Like I love that
Space.
Dennis like wanted to have it for you if you really were like dying in pain, needed it.
There
but
was a time in the hospital though that I was like, I'm actually in the most pain I've ever been in my life. But I take that back because there was another time I was in the
I was
most pain
gonna
I've ever been in my
say
life.
what?
But
Did you take a Vicodin when you had those?
I did not. Nope. I had kidney stones and that was I had to go to the hospital actually. So they did give me pain meds. But when I got out, I didn't take anything and I just
Oof.
suffered through it and it was fine. It was not fine, but I'm here to say that I'm alive. Um, but in the hospital, there was a time where I was like, I'm not doing well. Like, this is not good. I'm in a lot of pain. And he's like, just take something. And the lady comes in with her little syringe to like hook up to me. And I was like, no, how about an ibuprofen? She's like, well, the ibuprofen isn't going to help. You're still going to be in pain. And I'm like, yeah, but I won't be in as much pain and I
Mhm.
could still take care of my daughter.
Yeah.
So ibuprofen me up, like whatever. And she was like, okay, you have to sign this thing that I declined, whatever they were going to give me.
Dude, this thing is backwards.
And I signed it because I was like, yeah, dude, my body, my choice. I'm just kidding. But also like,
Also,
just give me what I'm saying. Like, I'm telling you what I want. And
oh
yeah,
my God.
but so I still have that full, I think we threw them away or flushed them. I don't know what we did with them, but they're gone now. But on the bottle, it had 3 for refills.
Dude.
I mean, I was in pain after when I got home. I was in pain, but I didn't take a single thing.
That's
And I
the
was
part that makes me think they're like legitimately intending to create addicts. Like they just want to destroy
Yeah.
families and make people hooked
Oh,
on shit.
1,000%.
Yeah.
and I could like imagine if I did get addicted to that, and how am I going to take care of my family? Like,
Well, yeah.
you
I mean,
can't.
it's like
You can't.
insidious. They're preying on like
A weak
young
person or something like that.
yes.
Well, and also like
Ew.
I could see how like somebody who is in that much pain takes that and can
Yeah.
handle so like Dennis could handle pain meds and doesn't get sick off of
Well,
them
that's what I'm about to
and
say. Like
feels great.
I got no hives coming over here, hitting me with all the
Exactly.
pain. I love to take a ride.
See? And but see, I don't. I hate it. I would rather feel all the pain in the world because I'm like, I would rather feel that than feel the other way.
Yeah.
Uncomfortable and just sick and
But
whatever.
that's the thing is like,
There's people like Dennis and you that are like,
and those are the
cannot
people that could get like really there
addicted.
you go. Yep.
Yep.
Mhm.
Slippery
And
slope.
even Dennis, he had his wisdom teeth out and they prescribed him hydrocodone,
Mhm.
codone, whatever. And they did a good job though, because they only prescribed him like so many
Yeah.
and no refills. And I appreciate that because
Mhm.
that's how you should do it.
Right.
Because he doesn't need it a week from now. He doesn't need it does not need the pain meds a week from now. If he's still in pain after a week of getting your wisdom teeth pulled, then you go back to the doctor
Right.
and see what's going on because you should be fine. And he took one that day and then didn't take. He was fine. But he said he's like, if I didn't have like if I had a like addicted personality, like I could continue to take them because I felt nothing. Like
Yeah.
I felt like I
Mhm.
was he said he was like floating and felt like, he felt zero pain. He felt like he could go and eat a steak, like right after taking those pills because he had zero pain.
Wow.
Mhm.
He's like, he's like, I was tired, I was loopy, but I could have, went and worked out or I could have done, like.
That's like a good way to say it. Like to say that like you could have gone and eaten a steak like right after your wisdom teeth. That's like
Yeah.
that's a good way to describe what a painkiller could do for you.
Yeah. And then like later he like started feeling some pain and I was like, I'm not giving it to you again.
Yeah.
Like, I mean, he could
Flush
have got
'em.
it himself, but I did. I told him, I was
Yeah.
like, we're not going down that route. Like, you just told me you felt zero pain. You could go eat a steak.
Floating
Like,
on a cloud. You ain't going back.
okay, let me pop that little dream bubble. Cause
Keep your feet on the ground, sir. Oh my
His
God.
really
temporary escape went away.
Well, the moral of this whole story is that if any doctor tells you to get a spinal fusion,
oh,
run the other direction.
come see us. I'm just kidding.
Yes, truly.
But also I'm not kidding at all. It's sad. It really is sad. I feel for people that are, I don't know, like
It's sad because it's people looking for legitimate, like people who need help and
that are in
what they're
pain. They're in
getting isn't
pain.
help. Yeah.
They are in pain and they want that help. They
Yeah.
want that relief. They want that, they're desperate. They'll do it. Like I said, if I had to stand there and go like this, I would fire me up.
Well,
I'm
and I
doing
also
it.
feel
That
like
was
all these
me. I
people
did
like who are
everything I could.
the
Yeah.
people who are in there
Like,
like
yeah.
who are like willing to undergo like a hip replacement.
Oh God.
would probably be willing to undergo Jane Fonda's if like the people in white coats were forcing them to do that instead. They would.
Since my oh so great mom's not gonna watch this podcast, I'm gonna throw her ass under the bus right now.
Ugh.
Who?
This my mom. She ain't watching
Oh.
this podcast. I know she ain't. She ain't at least getting this far if she
She's
does
blocked.
start it. But sis hurt her hip the other day. Couldn't even walk. We had to cancel our Costco trip in the parking lot. I had to run to the car, get the car, pull it around, and get her into the car because she couldn't even move. And I was so mad because I had been telling her to do fondas and just the usual stuff because she had been complaining of like a slight pain in her hip. And at one point, Maddie was here when she had a real pain in her hip and she could barely walk.
Yeah.
We fixed it with some little bit of fondas and then she did them for like 3 days and then she stopped. So what do you know? The pain comes back because she never actually took care of it. It was a temporary fix because she didn't continue on. But the pain comes back. We're in the Costco, whatever. She could barely even get out of the car. Like I'm having to help her, hold her up, carry her, and get her in the house, right? She's mad at everybody because this is everybody's fault but hers.
Sounds like me a couple years ago.
Proceeds to tell me that she needs a hip replacement. And I had to walk out of I didn't even say anything to her. I just walked out of the room and I was like, now I'm going to go eat ice cream because I have heard enough today.
God.
So I ate ice cream and then my dad was like, what's wrong? Because he obviously could see that I was mad and eating an ice cream. And he's like, what's wrong? And I was like, well, she thinks she needs a hip replacement. What she needs to do is strengthen that ass because she ain't got none. And that's why her freaking hip hurts. I mean, I was all, I'm not going to say you're wrong, but let's look it up on YouTube. I'm like, okay. So he looks it up on YouTube. The first like 3 videos he looked up told him or told whoever was looking it up about this hip pain to stretch it. So I was like, no, dad, no, dad. So then I'm like scrolling and it was like the maybe 4th or 5th video. This other guy was like, goes into this whole, it was like an hour-long video. And I was like, okay, I can't listen to all this. Like I'm trying to like find, so I'm like 15 seconds, like trying to find the spot. Long story short, I ended up finding it. And I was like, please just let me, I'm going in there first thing in the morning, make sure she's dressed. And then I'm gonna sleep on this anger. Tomorrow morning, I'm going in there. We're going to fix it. Same thing. So she took a ibuprofen and then she's like, oh, it kind of feels better, but I could still feel it. I can't move it. She's like sleeping or puts her leg propped up on a thing. And I just like left the room because I was like, so it's like nails on chalkboard.
I know.
The next morning, she's like, the ibuprofen wore off. It hurts so bad, blah, blah, blah. And I was like, I'm going to have you not say one word to me for 20 minutes. 20 minutes of not one word. I don't care if it hurts. If it burns, you are going to love that burn and we're just going to embrace it. Whatever. 20 minutes later, stands up to like, because I told her to go for a walk, stood up, 0 pain. 0. Then she says, well, maybe it's still the ibuprofen from last night.
She sounds like my mom, dude.
I was like, bro.
Like my mom too. Wow.
No. Anyway, long story short, she now believes she's been doing them consistently. Not as often as I would like, but she has been doing them.
But she's doing them.
Now she doesn't think she needs a hip replacement.
Oh, wow.
But
The
she
story is a happy ending.
she needed a hip replacement. Oh, she does not because I want her to do them with ankle weights every day. This was with no weight. So imagine how much better she would feel.
Yeah, she
with
really
weight.
needs weights. She really needs weights.
Yeah. But she's doing them. It's fine. She doesn't need a hip replacement.
It's a start. Snaps for Miss Teresa. Good job.
Yeah. My dad says she does them every morning on her own before she gets out of bed.
All
Does
right.
she do 'em
Hey,
right?
you're making a difference.
I don't know, but she doesn't need a hip replacement.
Thank God.
If she honestly, Maddie, if she would have had a hip replacement, I would have. I don't know what I would have done.
Yeah,
I would have hip replaced her myself.
Yeah.
I don't know. I probably would have went into the appointment with her like guns blazing. Like, come on, you're gonna slice my mama up? Let's square up, bitch.
Oh my God.
What you got?
If you guys would have walked into, I have to like real quick. I should have just said this earlier. You guys would die. So you both know I was in a car accident like 3 weeks ago, like a month ago. Never believed in whiplash. I was like, lying people, whatever. But I got hit at like I was at a dead stop and I got hit at like 50 miles per hour. So like the car behind me was like totaled. There's like people in there. Anyway, whatever. Fast forward to I have to get my car fixed. Obviously, I don't have insurance, like medical insurance, and I went like to work straight after. All the adrenaline, whatever, was fine. I was like a little nauseated, and then like the next day, the next couple days, like super duper stiff. And I'm like, okay, maybe I should like just get an X-ray, like whatever. So I go in to get X-rays. They send me to this Southern Nevada chiropractic, whatever, to get like checked. You guys would walk in there. Their their way of like fixing you, because like with my back issues, like my history, I was like, fuck, like I should just like get scans and see, make sure I'm okay, because I couldn't really move. But I go in there and they're fixing you. Their therapy is slapping these like electrode
Stim?
yeah, like this electric stimulator patches for like 10 minutes. And then moving you over to either a massage chair or a massage bed.
And it rolls.
And it rolls, for like another 10, like
I'm
10,
so
15
mad,
minutes.
dude. Like what fucking witch doctor alligator tears salesman sold that fucking thing?
Dude. And then they ask you questions. How are you, do you have any headaches? Do you have any like nausea? Do you have any like how's your shoulders? How's your upper back? How's your lower back? This and that, and like whatever. And this is gonna be like a long story for like another time, because they tried to tell you to like say that you're in pain, or like the more that you say type stuff, whatever. And I'm just like, I just want to make sure like I don't, like my discs are fine and whatever. They're like, you have to like avoid doing the gym and whatever. And I'm like, no. I came home. When I told Joel, I was like, oh my God. When they said because they saw my bottle, all of this, they're like, okay, you work out, so you have to be careful, and like all this nonsense and blah, 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 blah. And was saying like you can't go to the gym, you can't, like you have to be careful, blah 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 blah. The first thing I did is like I told Joel, I said, well, they're on crack and they think I'm not gonna go to the gym. While they put little patches of electric stimulation to like help with the whiplash, because I did have like pretty bad whiplash, like I couldn't turn my head. And they on Thursday they did like a chiropractor did an adjustment, so she like popped my neck and did something else, and like my neck is still stiff from her adjustment. That was like, that wasn't there.
I would have see, that freaks me out. I wouldn't have I don't like that.
I didn't like it.
So did you do TYs and I's?
I did them with Maddie on Mondays.
And how did it feel?
I did do them today, but
I did them today and they help.
So my professional PhD experience of I'm gonna get my what's her name? Elizabeth? Was it?
Oh yeah, Theranos.
Yeah. So well, anyway, what happens, you get the whiplash. You got the whiplash and your muscles are completely stretched out to the max because you're freaking flung forward. So then we got to strengthen them back up to put them back in place.
Not avoid the gym.
No, I mean, yeah, maybe probably avoid doing like bar muscle ups or like or like snatches, but maybe not avoid strengthening and being in the right position and putting yourself in the right posture positions and strengthening that position.
These people have no clue. No clue.
And you know what you said earlier about walking into these places and seeing like these people that are treating you or helping you, clearly their habits, you can see their habits.
Misery loves company, baby. They're like, skip the gym today, Mo.
You know, you want to go to McDonald's? Here's a McDonald's. Actually, no shade to McDonald's because bitch loves McDonald's. But I'm just saying, like,
Yeah.
It's so true. I'm hearing these conversations because for some reason, a lot of people don't think that I speak Spanish or understand Spanish. And a lot of the girls that were there were speaking Spanish like
Oh,
amongst
what were they
themselves
saying? I
while I'm
love
getting
this. I
like
love this.
electrocuted and they're doing all these things and they're talking about like these restaurants and this food and like I had this and like whatever. And it
Oh,
shows, like unfortunately it shows. And I'm like, damn, I don't belong here. Like, what am I doing?
Yeah.
You're not helping me. You're telling me not to go to the gym.
Yeah.
I
What is
know.
this? What just
It's the DMV, right, dude? It's like, you
Yeah.
guys are gonna tell me how to get better? I don't think so. I'm better off than you guys are, even if I'm hurt.
Yeah. Oh, yeah. Oh, yeah. Dude, I don't know. I've been to plenty of chiropractors because back in my day of young and not doing my own researches, and I used to go to chiropractors because they felt good, I guess, is what you could say.
yeah.
To get your back cracked, it does feel good sometimes. I don't like when they like fuck with my neck, like hardly ever. I hate that. I never did like that. But there was this one chiropractor that I used to go to in San Diego, and he swore that you, if you like the posture, like the hunch,
Mm-hmm.
that he could like pop your back into place if you went and saw him so many times. And I remember being there thinking, no, this is like muscular.
Mm-hmm.
Like this is a muscular position to like have proper posture. That's I mean, anybody that does not have good posture, a lot of women, especially women with big chi-chis, because we tend to fold forward a lot because of the weight, and we just, it's not, we don't like to just sit there with our boobs out. Um, but anybody with bad posture, which is 98% of everybody, um, just stay like this with great posture, holding your core in nice and tight and up. You are going to feel how hard that is after, like, I don't know, 5 minutes, even after 2 minutes, I could
Yeah.
feel something starting to burn. That is not popping my back into place. That is my muscles actually holding this into place and being self-aware of what my body is being perfectly aligned
Mm-hmm.
in place. And I remember sitting there, I maybe was like 23 or 24. I was like, you're going to pop my back into place. That seems like a little impossible, but I was like, all right, okay. So he would go and like pop our backs. And I was just like, okay, it felt good, but like now you're not going to tell me that I'm like 3 inches taller. Like,
Yeah.
And they do
'cause
tell you that.
yeah, but I wasn't because my ass was still sitting there slouched. So like, you're lying. But I remember like that was my first like time that I was thinking like that this is not right. Like this is not correct
Mm-hmm.
in any way. But a lot of people believe in this, chiropractors. And I'm not saying that if you tell me I go to the chiropractor because it feels good and I feel like it, I mean, I'm not going to lie. Sometimes when I deadlift and my back cracks and it feels great, I'm like, oh,
Exactly. Yeah. Well, and there's nothing wrong with that, but yeah, just the crack
but,
part isn't gonna help.
but if you're telling me you're going to the chiropractor because your rib is out or because your back hurts, that's a problem. That's not a problem the chiropractor is going to fix. It's a problem that you yourself need to fix.
Mic
Like
drop.
drop. But yes, that's
Oh man. Okay. Well, that was really fabulous. I feel like we should probably wrap it up. That was a long one,
yeah.
but a good one. So maybe we have some hot takes or something of that nature to close it out. Mo, do you have like an unpopular opinion? Or you could well, let's start with that. I mean, we just gave a bunch of really unpopular opinions, but like, I don't know, like
I'm
pop culture, like
just waiting to
something.
get blocked on YouTube, but that's
Yeah.
it.
You guys go first. Well, I think.
Okay, let me think.
You could talk about the Mojave Games.
Oh.
That's gonna be a whole 2
Whole
hours.
3 hours, I know. Part 2 coming up.
Let me think.
Hot take, hot take. What's going on right now?
Okay,
Tia Toomey's pregnant.
who's pregnant?
Tia Toomey's pregnant.
Oh
That's right.
yeah. I love it.
Hot takes on that. What do we
So she's out
I'm
for
here
this
for
year,
it.
the 2023.
So you're
She's gonna
saying
come
there's
back
a chance.
2024.
Valerie
Um,
said she wasn't surprised that Tia did like pulled a move like this. Like it's not quite retirement, but
I feel that too. And also I feel like if she comes back and loses, then
yeah,
it's not that big of a hit because she had a kid, which is
yeah,
she's still going to be great. I absolutely
yeah,
agree with that. I also I was looking at some of her pictures and like I am not one to talk because mama gained some weight when she was pregnant, a lot of weight. Um, but she's definitely like her arms gone, gone,
yeah. Well, I mean, like
gone.
her body's definitely changing, and I think maybe she stopped cycling some of those roids when she was trying to have a baby, so that would
Baby.
help with those arms too a little bit.
Yeah. But yeah, that was definitely like one of the first things I noticed is that like her arms are definitely not where they were, which is fine. Like, okay, cool. You did your thing, girl. Go ahead. Go ahead. But also like, don't lie to us. Don't lie. Just be honest.
Wait,
Tell
about
us
what? The
about the
roids?
roids.
Oh,
Yeah.
I
Like
know.
I don't I would just you don't just be honest. That's all I'm gonna say.
No, she ain't gonna be
But
honest.
I also I'm curious to see how this plays out. And I don't know, like for the mom side of me, like the Cara Saunders and like the Annie Thor's daughter, um, like their comebacks were so cool, and I don't think that her comeback is not
Mhm.
going to be, not cool or anything. Um, but I'm curious to see how she handles such a big change to her body, and
Mm-hmm.
it's a very big foreign change because you think it's going to go one way and it goes completely a whole other way. So I am curious to see how it goes for her body and how she comes back. I do think she's going to come back and be fine and be cool. But
Yeah, we'll see what she even does. But I did think that she looked, well, first she went blonde, and I was like, okay, this thing.
Oh yeah, I noticed. Yeah, that's true.
And
I
then
didn't
now she's
notice
pregnant,
that.
and I do feel like she's made like kind of a big, like, I don't know, just like all I saw were like those pictures that you sent me of her like announcement or whatever.
Uh-huh.
But there was a whole shift in her like energy and persona and just everything. I just felt, I was like, wow, she's giving a whole different person right now.
Yeah.
Like she doesn't look like just in general. It's like
Tia.
she's like just like maternal, feminine, like
Yes.
divine, feminine, motherly energy, and I'm living for it.
Yeah,
Yeah.
I definitely got that from her too.
I really like
I,
her and Shane. Like they're one of my favorite CrossFit couples. I think they're really entertaining and a good team and really fun to watch. A little bit like, I mean, I'll give you a little bit like kind of you and Dennis. He coaches her and
oh Lord. And end it now. I'm just kidding. I do think it's really cute though. Like I always find him so happy in her success. And
Yeah.
I see that a lot in like Dennis. And
Mhm.
there's this one picture, and I have been dying to post it on social media, but I also love it just for me.
Yeah.
And there's this one picture, he's like holding Arya, and it's at the Mojave Games. And he's like holding Arya, and he just looks like so happy, like just watching
Yeah.
me. Like, I mean, I'm hoping it's me. I don't know. I'm not. I'm not on the other side
It
of the
was
Was
picture.
this
you.
during the lifting one?
Yeah.
Did
Yeah,
I take that?
No, the photographer
it
took
was on the
it.
Oh, I
Mojave.
want to see.
Oh, let me see. I have it as my
Oh, it's
favorite.
okay. Save it for you. Save it for you.
It's okay.
I sent it to her.
Yeah. I didn't even
Mo,
see
send it
it.
to
She
me.
just sent it. Yeah. But it was he just looks so happy
You can like see it in his
being
eyes. Yeah.
happy, yeah, for me. And I love that. And also like going back to the Mojave Games, like I wasn't even gonna do competitions anymore. Like I was like kind of just gonna like lift and do whatever. And so here.
Oh, that's a good one. Look at Arya too.
Aria, her little chubby chubbies. Her chubby chubbies.
Oh man, that's a good
Um,
one.
but he's just like staring, and I don't know, like maybe it's nothing, and I'm like reading into it, but like I feel like he's just always so happy, like just so happy in like my success and like anything that he's just so proud, and I love that about him, and I see that a lot in Shane, and I
Yeah.
love that about Shane and Tia. Like I love
Yeah.
like their dynamic like that. Although one time I watched this YouTube video and he was like coaching her, and I was like, oh, I would have fucking killed Dennis. It would have been, my CrossFit Games career would have been done because I would have lost it. I would have killed him. She was like, I thought it was 5 rounds or something like that. And he's like, no, it's 6, go. And I'm like, oh, if Dennis would have said that to me, I'd have been like, dude, 5 rounds right now. And we're fighting for the 6th one. Like, we're dead. Done. Like, I don't know. And she just did it. She just like,
Yeah.
I guess because it's her coach. And
Mhm.
I don't know. Dennis does know some stuff though, when it comes to like,
Yeah.
to
You gotta
like,
give Coach Dennis a little credit. Demo Dennis.
No, give him a
Demo
lot
Dennis.
of credit. Every competition, even like this last one the 3 of us did, whenever I was doing mine, he would yell. I hear nobody. Like literally I hear nobody, but
His
then
voice
he
is
says something and I'm like,
carries.
damn.
Yeah.
Yeah.
Like
He did. I will say on that last burpee one, he was like,
Mhm.
down.
yeah.
Yeah. And then I think it was no, maybe not Valerie, but somebody said that the team next to us
The
was
other
Yeah.
like
team.
going
Mhm.
with his.
You're
I
like,
was
okay,
like,
go do what he says.
yeah.
Do what
I was
Shane
like,
says.
yeah.
Get your own coach.
Oh
Yeah.
my God, how funny. Okay, well, that's good. Yeah, it'll be very
Yeah.
exciting to follow Tia's motherhood journey.
I
Love
also want to know how
that.
far along she is.
I wonder
She
that
looks
too.
She
kind of
looks pretty
big.
far along.
Yeah.
Yeah.
She does look kind of
Which I was
big.
like wondering, because when was this last competition that she did?
The games, dude. She hasn't done
Was
one
it the
since.
games?
Yeah, which
When was the
was
games? Like
August.
okay, August. But she looks
October,
like she's
November,
like 6,
December.
7
Yeah,
months
I feel
pregnant.
like she does. She looks like she could be like 6 months. So August, September, October, November, December.
Yeah,
4
but
months?
you have to also think
She might be
that
showing more because she's so small.
exactly.
Yeah.
She has
Yeah.
like 0. Well, going into this, she probably had like, I don't know,
Yeah.
5% body fat. So she's showing more.
Yeah.
Also, if you have like, I have a shorter torso, so you tend to show more.
Mhm.
Whereas like somebody who's really tall, it takes a while for them to show. Like Tiffany, she didn't show started showing before her, and she was
Yeah,
due
she was
before
pregnant
me.
first. Yeah,
Yeah. But because I am like smaller through my torso, and
right.
she is kind of tiny.
Yeah.
She's
So
pretty tiny
maybe,
in that
okay,
way.
maybe.
But
Yeah,
4 months,
I guess they
let's
really
see.
celebrated after that win.
You know what? She
Yeah.
probably she probably did like got off of her like cycle of everything.
Yeah,
And then that's probably how that happened.
because that was the first thing I thought. I was like, damn, I'm actually impressed that she could even get pregnant.
I thought that too. And I was like, am I being a bitch? Like, but
No.
also like if she was not, she like ended the cycle. It was like tapering off. Then by the time she got to the games, it was like out of her system because
Yeah.
they test.
Mhm.
Then she gets pregnant. It's not, I guess,
Yeah,
not in her system anymore.
yeah.
So like, okay.
I guess we'll see what happens. Very exciting stuff.
Yeah.
But I don't know. I feel like maybe we should wrap it up there, ladies. What do you think?
Sounds
Do we have
good.
any more hot takes that we have to throw in to the mix?
Did
before we
you
close?
do anything with Lilo? Watch any Lilo movies lately?
No, I haven't watched any Lilo movies.
Did
know
you
what?
watch it, Mo? No.
Lilo?
That's a no.
Is this like
Lindsay Lohan.
I
Oh,
did just
no.
watch a video about like I'm just seeing all this like stuff like is the Idaho quadruple murder case gonna go cold?
That has to be a different podcast. This
Okay.
is what, like, this is already what
3
are we at, like,
hours.
2 hours?
Okay, all
This is
right.
what always happens. But you know what?
Okay.
I don't think it's gonna go cold, and that's my thoughts on it. And you know what? They know who did it,
It's
but
not
they just
going
don't. They
cold.
have to get all their information on it, and they have all the evidence, but they want to make sure that they have the right guy because they don't want it to go into trial and then him have a reason to like get out. That is it.
Okay, I like that. I'm with it.
Next podcast.
This was my 10 seconds, like when this first happened, by the way. This is killing me.
This is
John
ongoing.
Benet Ramsey triggering moment right now. This Idaho murder thing.
Okay, well, we'll see. I mean, I just keep seeing people saying they should get the
I
FBI
know.
involved, but who could trust
They
the
do.
FBI?
They
Hello,
do.
Twitter
Oh, I
files.
know. I know.
mean,
I know.
nobody
I know. I
trusts
know.
them. We don't need them
My
involved in
dad
what?
said. My dad said, bunch of crooks. That's what
They
he said the
are.
other day.
They are.
But they did get the FBI involved, and they used to have 42 agents, and now they have 60 agents on this one case. Which, like, a normal like murder case, they have like 1 or 2 FBI agents, or like one FBI
I know.
profiler or like,
You
yeah.
think, okay, remember, I know we already, I think I answered this and I said that I didn't think so, but I don't know now. Do you think the other roommates are involved?
Okay.
I do.
I think they know more
Then
than
they're leading on.
what they're
You
saying.
think some people are like lying for the killer?
But no, so here's what I think. I think they know more than what they're saying to the public, but they said what they know to the police.
Mm,
And what they know might not be, I don't think they're lying for the killer. They might know the killer. But I mean, so I've heard like misleading things. I also am like really wanting the facts from the police because it drives me nuts. But I've heard some things like they heard some rustling upstairs, or they heard, so they locked their door because they thought that they had people over or whatever, which I don't know. I lived in a college house with a bunch of roommates at one point, and I mean, I could vouch that when they had
Kinda
people
get
over
it.
sometimes, I'm like, all right, cool. Like, just lock my
Bye.
door,
Yeah.
throw on some headphones and go to sleep. Like,
Yeah.
I could understand that. But it's just, I can't, I can't see them knowing and not saying. They're too young. They're too dumb. Like, you don't have any life experiences at that point. And to lie at that capacity is pretty hard.
It is.
Especially with the case being, they would have slipped by now for sure.
Yeah.
So what they do know, they've said, but they have not said it to the public. And then to be fair, I probably wouldn't either. I probably would go dark if this happened to like my roommates or whatever. I would go dark, like 1000% go dark. I mean, it
Yeah.
has been some time, and I mean, it's been 40 days. I think I've seen a little over 40 days maybe, and the ex-boyfriend barely came out and said anything.
Yeah.
So like, it's like, okay, they are not saying, they're probably being advised that
They're lawyers. I mean,
you
they're all
should
definitely
not,
lawyered up and they're
yeah,
being told you can say
not
one
to do
thing and it's
something. And this is like a huge thing. So like, imagine somebody coming to you and be like, do not say anything. And you wouldn't say anything because one, you're young, you're
Yeah.
impressionable. And two, like, you don't know what's going to happen. Like,
Oh my gosh. Okay. Well, time will tell. This is all bulletins as they break. But until next time, you're not hungry. You're
you're
bored.
bored. Close that fridge.
Your Wonder Puff jacket?
I didn't buy it because I didn't buy it.
I'm
I
not
don't
getting
know.
off this call until you buy that off the app right this minute. What are
wait
you
till it goes
doing
on
over there?
sale. It's going on
I
sale.
also took back a line leggings that had a hole in the seam today.
But I'm mad you didn't get the jacket though.
I know.
You
I
got
still
my
have it in my
hopes up.
cart. Let me see. It's really good though. It really is a good jacket.
I
should
can't
just
believe
buy
you're
it.
buying it. Add to cart. Add
It's
to.
already in my cart along with
Yeah,
3
we'll
other
check out
things.
then.
Check out.
I should just pull the trigger. It's
You will
only
never
150.
regret that. You're gonna use that every single winter. Come on.
I know.
Until they come out with a new one next year.
No, the
no,
coat that I have
reminds
is
me of,
old.
like, that reminds me of my parka. It's like something you'll always use.
Yeah. And
Yeah.
it's green. It's sold out.
Stop. No, it's not.
Yeah. It is.
Jesus,
I'm
Laura.
going on the up to confirm.
It says it's sold out, but it's letting me place the order. You think I could do it?
I mean, you could try.
It's testing you. Oh wow, it's on sale.
It's on big time sale.
Yeah. Mine doesn't say. Mine says in stock. Wait, what size are you looking at?
Come on.
12.
It's in stock.
It
It's in
is?
stock online. Maybe that's
Yeah.
why it's telling you.
Oh,
Dude, it's
well,
it's $149 with the discount.
it's
Did you
not.
just buy it?
Oh, thank God. Now I can sleep tonight.